Do you want to help solve a cold case? If you do, we have some exciting news. We're teaming up with a very well-known DNA and genetic genealogy company to solve a cold case. In a few weeks, we'll release a video with more details about the case we'll help solve. We'll be doing this through YouTube memberships. Half the money we receive will go to funding DNA testing and genetic genealogy, which will hopefully help solve the cold case. We have 2 membership levels, and both will help solve the cold case. But you'll also get more perks with your membership. With our lowest membership, you'll get loyalty badges, exclusive emojis, early access to videos, and a 15% discount on merchandise. With a higher membership, you'll get all those perks, plus an extra 10% off merch, an exclusive members-only video every month, and you'll be able to vote on the video's topic. But we think the most important aspect of the membership is to help solve the cold case. Once the case is solved, we'll do a video about it, and, with your permission, we'll have your name or username appear in the credits. This is your chance to change from a passive observer to an active participant in solving a murder. With your help, we hope to bring a killer to justice and give a family some closure. Not only will you help solve a cold case, but you'll also be supporting this channel as well. Thank you so much for watching this video. Please keep an eye out for a video about what crime will help solve. In the meantime, if you're interested in membership, please sign up so you can get early access to videos, the exclusive members-only videos, and other perks. Once again, thanks for watching. Number 3. Unnamed French Man. In 2007, the peer-reviewed journal, The Lancet, published an article titled "Brain of a White-Collar Worker." It was about a 44-year-old civil servant who was never identified. He lived in Marseille, France, and he was married and had 2 children. He went to the doctor because for the past 2 weeks he had felt a weakness in his left leg. The doctor looked at his records. He learned that when the man was 6 months old, he received a ventricular atrial shunt to treat hydrocephalus, a condition in which excess cerebrospinal fluid accumulates within the ventricles of the brain. It is commonly known as water on the brain. When he was 14 years old, he had problems with his left leg. He had uncontrolled spasms, and at times it was weak. The shunt was removed, and the problems with his left leg went away. The doctor decided to have the man undergo CT and MRI scans. The results showed the doctors something remarkable. The man's skull was full of cerebrospinal fluid that cushions the brain, and he only had a thin layer of brain tissue. His brain was about 90% smaller than average. It was initially thought that the rest of the brain was destroyed and replaced with the fluid. But years after the article was first published, experts said that in the 30 years after the shunt was removed, the man's brain was compressed into a thin layer. Amazingly, even though 90% of his brain had been compressed, he lived a normal life. He had an IQ of 75, which is below average, but is not considered mentally disabled. The man's condition gave researchers a lot of insight into the understanding of the brain. Notably, it gave them clues about the consciousness, which is the awareness of our existence. Researchers now believe that there are several areas in the brain that are responsible for consciousness. Number 2. Velma Thomas. In May 2008, 59-year-old Velma Thomas lived in Nitro, West Virginia. When she was at home, she suffered a massive heart attack. Paramedics were called to her home, and they performed CPR on her. After 8 minutes of working on her, they found a pulse. She was taken to the hospital. The hospital used a special machine that induces hypothermia to reduce brain damage. While undergoing the treatment, her heart stopped again. She was revived, but hours later, her heart stopped a 3rd time, so she was put on life support. Velma was on life support for 17 hours, and there was no pulse, no blood pressure, or any measurable brain activity. Velma's family sadly realized she was gone. Her son, Tim Thomas, told the Charleston Daily Mail, quote, "Her skin had already started hardening. Her hands and toes were curling up. They were already drawn. There was no life there," unquote. The family decided it was best to take her off life support. Tim said he felt at peace and believed he had made the right choice. Tim and other family members all said their goodbyes. Then they left to make funeral arrangements. When they left the hospital, Velma didn't have a heartbeat. The respirator was turned off after the family left. About 10 minutes later, the nurses started removing the tubing. Then Velma started moving her arms, and then she coughed. She then shocked the hospital staff by talking. The hospital staff called the family and told them to come back to the hospital. When they arrived, they were amazed to see Velma alive and talking. While Velma was in the hospital, she even did an interview with the local television station. Velma experienced a phenomenon called the Lazarus syndrome, also known as auto-resuscitation, after failed cardiopulmonary resuscitation. Lazarus is a biblical figure in the New Testament who was raised from the dead by Jesus. The syndrome is when someone spontaneously comes back to life. Medical professionals are unsure why it happens, but several recorded cases exist. Velma Thomas holds the record for the longest time being clinically dead before coming back to life. Number 1. Gloria Ramirez. In early 1994, 31-year-old Gloria Ramirez of Riverside, California, received some terrible news. She was diagnosed with advanced cervical cancer. On February 19, 1994, Ramirez was feeling confused. She had an irregular heartbeat and difficulty breathing. Over the previous few days, she had been nauseous and vomited several times. 911 was called, and first responders went to her home. She was placed in an ambulance and put on oxygen. She was transported to the emergency room at Riverside General Hospital. As the attending staff worked to stabilize her, they noticed an unusual, oily sheen covering her body and a fruity, garlic-like odor emanating from her mouth. A registered nurse, Susan Kane, drew some blood from Ramirez's arm. She noticed a chemical smell. She passed the tube with the blood in it to medical resident Julie Gonchinsky. Gonchinsky saw manila-colored particles in the blood. Respiratory therapist Maureen Welch also smelled the chemical odor. She described it as similar to ammonia. She thought it was coming from the syringe. Suddenly, Susan Kane fainted. Then Julie Gonchinsky started to feel lightheaded. She went to the nurse's station, where she also fainted. Then Maureen Welch fainted. Other staff members got sick, and the emergency room had to be evacuated. Minimal staff remained to work on Ramirez, but she died about an hour after arriving at the hospital. Out of the 37 employees working that day, 23 fell ill. 6 had to be hospitalized. 5 were released the next day. Julie Gonchinsky was the worst off. She spent 2 weeks in the intensive care unit. She had tremors and apnea. She also suffered with hepatitis, pancreatitis, and avascular neurosis in her knees. Avascular neurosis is a serious medical condition in which bone tissue is deprived of its blood supply, causing it to die. 2 months after the incident, Gonchinsky had surgery on her knees. In the media, Gloria Ramirez was labeled the toxic woman. An autopsy was performed and no toxins were found in her body. Also, no toxins were found in the hospital's plumbing or ventilation system. Ramirez had died of kidney failure as a result of her cervical cancer. But what made her blood so toxic that it hospitalized 6 medical professionals and made 17 others ill? Some thought it was a case of mass hysteria, but people like Julie Gornichewski do not believe this. The leading theory involves a chemical called dimethylphosphatide, also known as DMSO. DMSO is often utilized for its anti-inflammatory and pain-relieving properties. It's also made naturally in the body. Ramirez had DMSO levels that were 3 times higher than usual. It's believed that Ramirez was treating herself with DMSO because of her cervical cancer. She may have covered her body with DMSO cream before she died. This would explain the oily sheen on her body. Hospital workers also noted a garlic smell emanating from her mouth. When DMSO metabolizes in the body, it can cause the person to have garlicky breath. DMSO is usually not toxic, but there was a chemical conversion in Ramirez's body when she was given oxygen in the ambulance. When one oxygen atom is added to DMSO, it becomes dimethyl sulfate, a highly toxic substance that can cause severe irritation to the eyes, skin, and respiratory tract. In larger doses, it can cause systemic toxicity, leading to organ damage, and is possibly fatal. Many of these are the symptoms that the hospital staff experienced. However, Ramirez's family claims she did not use DMSO. They believe the hospital is responsible for the toxic event. Thank you so much for watching this video. We hope you found it interesting. If you did find it interesting, please make sure you subscribe. We'll have a new video about the paranormal every week. If you just discovered this channel, please make sure you check out our other channel, Criminally Listed. We have over 325 videos featuring bizarre but true crime stories. You can find it at youtube.com/criminallylisted. But that's all for today. Thanks again for watching.